Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you for the opportunity. So here I am. They say that the worst place to be in the speaking slot is the one after lunch, as you're all sort of having your postprandial snooze. But here I am standing between you and refreshments. And most importantly, I'm standing between me and refreshments. So I am going to talk quite quickly to get through my few slides that I've got, and it literally is a few. So today we're reflecting on equity, health and well-being. And as Jeff has already said, to some extent the future is already here, but we certainly cannot wait for it. Our health system, the one that we are all part of, plays a critical role and will continue to do so into the future, whatever Heather and the team recommend, and indeed whatever decisions the government takes. Our system and all of us in this system must continue to support individuals, whānau and indeed our communities towards better health and well-being. So quality living, healthy lives, well communities. So I get to do a Dhb perspective. So of course I chose my Dhb. It's almost as good as talking about yourself, isn't it? Talking about your Dhb. So this is our vision. This is the vision that our partners, the individuals in our communities all came together to determine way back in 2016. But all DHBs will have their own story and their own version of this aspiration. At the heart of our DHB strategy are four key imperatives. Commitment to the treaty underpins each and every one of these imperatives. Achieving equity of outcomes across communities, partnering with people and whānau to support health and well-being, connecting and transforming primary, community and specialist care, and of course quality and excellence by design. So to give life to the strategy, we've completely transformed the way we organise ourselves. So we don't have a provider arm, we don't have a funding arm. Actually, we have clusters, and these clusters focus on people or they focus on particular illnesses. So for example, if they're focusing on people, healthy ageing and rehabilitation. For illness, it's mental health and addictions. We have a number of clusters. Each of our clusters are supported by cluster alliance groups. So these cluster alliance groups provide representation from mana whenua, haora, which is our iwi relationship board, consumers, NGOs, primary care, you name it, everybody has a seat at the table. And those cluster alliance groups are set up to challenge us to be better than we are at the moment. They are going to help us to determine how we significantly shift our resources to change the way we both deliver and commission services so that we can make more of a difference in our community to deliver health and well-being and to ensure that we achieve equity. At the same time, we've got to ensure, as we disinvest to invest, we make sure our hospital is the best that it can be, but it only does what a hospital needs to do. So we also recognised in our district health board that we needed to get out to our communities and listen to them a lot more than we were. And we did this to get a better understanding of the communities and the people who live there. We wanted to understand the lifestyles, their health needs, their experience of career, their priorities and aspirations, not just for health, but for indeed their lives, for them and their families. Understanding our communities allows us to work in partnership with them to better design services that meet their needs, in fact, all of the needs. It gives us all skin in the game. I think we've already heard that today, skin in the game, because these are not the district health board's communities, these are the communities' communities. So a number of common messages came through, and we have not taken ownership of all of the things that are going to happen in these communities. We have cluster health and wellbeing plans, we have locality health and wellbeing plans. And in localities, we have health and wellbeing groups. And those health and wellbeing groups are not of the DHB, they are of the community, but they hold us to account. They hold us to account for the more than 250 expectations that they set for us, what they wanted us to achieve in their communities. So we have 5 localities, and there was a lot of commonality in the first 4 localities that we completed our locality health and wellbeing plans. Firstly, access to healthcare. So people wanted easy access to healthcare when they needed it. Mental health and addiction, that was an enduring concern of our communities. They wanted to see improved support for mental health and addiction in their communities. They wanted better communication and connection, so a district that has quality communication, connections between all of the health services, people, whānau and communities. And they wanted well communities, communities where everybody's supported to have quality living and healthy and active lives. So on the screen, that's what happened in Tararua when we came together. The last plan that we developed was in Palmerston North City. They had two further aspirations: building healthy whānau and communities, a city where people and whānaus feel safe and are supported to make healthy choices and stay well. And wider determinants of health and wellbeing was a strong feature. They wanted a city where residents have a good quality of life and everybody has the opportunity to achieve equitable health and wellbeing outcomes. The need for improved mental health and addiction support in our communities was a key priority, as I've already said, for every locality. Our communities told us of the desire to know more about where to access mental health services when they needed to. Our communities told us of the need to offer more support to people and whānau, especially our older residents who feel isolated. And perhaps most importantly, our communities told us of the need to ensure all of the people involved in the mental health care spectrum work together to support the community. Working together is going to be vital if we're going to change the way we support our communities. For far too long, we have all operated in silos. Silos within the health system, the health sector, silos between different sectors, even silos in our own organisations. The people that we are here to support don't care about silos. They don't care if we're a DHB, if we're primary care, inpatient, NGO. They don't care about those things. What they care about most is getting the help and support they need. And we must join them in this mindset by changing the way we operate. There is a great deal of fantastic work going on in our community and the strength of the passion is visible. But if we're going to build on the passion, we need to embrace a more collaborative, whole-of-system approach and no more so than to mental health. In our district, the approach we're committed to moves away from the individual and towards the collective. All of the partners in our region came together to develop the Waiora model, which focuses on four main principles: well-being, resilience, prevention and recovery. Waiora takes a holistic, whānau-centric approach that begins and ends with well-being. More recently, the additional concept of flourishing has been identified as an aspirational focus of well-being. The idea that a person living with a mental health condition can flourish requires a fundamental change in the way we've traditionally viewed the concept of wellness. By taking on the Waiora model, we must shift our focus away from the often negative connotations linked with the term well-being and encompass transformative pathways which enable our people, our whānau and our communities to flourish. What we want to do is challenge and inspire people by crafting a vision of a high-quality, whole-of-system approach to mental health care. And from Robinson Money, thank you. We're holding out for that bit. Some may believe this to be idealistic, but we also have seen the positive outcomes in our community. In our community, we also have whānau ora. Whānau ora is tangible evidence in a cross-section collaborative model with a specifically Māori worldview can transcend sectors to support people in whānau. In the MidCentral community, partners have come together to establish and support Kāinga Whānau Ora. Kāinga Whānau Ora is a local collective impact pilot focused on whānau living and social housing in Palmerston North. The focus is about family, and we all have a place in that. It focused initially on 100 families. Now, all of whānau live in safe, warm homes. They have pathways to training, education and employment and are supported and encouraged to live in safe, loving relationships. People within Kāinga Whānau Ora have gained full-time employment. Many have now exited social housing. The pilot has also helped to eliminate gang activity in parts of our community. And it's also helped to improve the lives of children by creating a safe, healthy, non-violent and drug-free environment for them to grow up in. This is a microcosm of our community and of all communities across New Zealand. So the question we have to ask ourselves, and again, that was the question that Jeff asked us, is how can we move the pilots, the new approaches and initiatives that we all have, where they're working, onto a national level. So what does our future look like? Well, it looks a lot like now, only different. And we all have a part to play in making that difference. After all, I think you've heard this before, it is the right of every individual to live in a decent and caring society, and most of all to have the opportunities to enjoy the same levels of health and well-being. Everyone. And when they are sick, to have access to the same specialised levels of care and treatment. So DHBs are about their communities, they are about all of us, so I didn't want to talk too much about the bit that we often talk about, the patient. So thank you for your time.